For further analysis on the current humanitarian situation in Gaza, we're joined from Ramallah by the Palestinian Red Crescent spokesperson, Ms. Nibel Farsakh. Welcome to Q News. Thank you so much for joining us. First off, how is the Palestinian Red Crescent preparing to address the possible famine and food insecurity in Gaza? And are there any specific programs or partnerships in place to provide food aid?
Good evening. Thanks for having me. The situation in north of Gaza is beyond catastrophic. The conditions where civilians are forced to endure are unbearable, and more cases of malnutrition have been reported by doctors among children and adults, especially after more than 1 month of complete besiege, where no aid is getting in. To the north of Gaza, Israel is not allowing any kind of aid to get into north of Gaza. This includes food, relief items, or even medical supplies. And the situation is only getting worse. It is absolutely beyond dire. So this is the situation in north of Gaza, while also other places in the Gaza Strip are also suffer because of the lack of aid is allowed to get into the Gaza Strip. During the past month, Israel is still obstructing the entry of a humanitarian aid, allowing only for a few aid trucks to get in, which do not fulfill the need of the entire population. Especially, we're talking about more than 1 year of the complete attacks and besiege of the north of Gaza, and the entire population here, more than 2 million people, are completely relying on the humanitarian assistance, while Israel is still obstructing the entry of a humanitarian aid, allowing only few aid trucks to get in, which absolutely still a drop in the ocean. And this is why the humanitarian situation is only getting worse. As for the Palestine Red Crescent, since the closure of Rafah crossing in May, we only received 65 aid trucks, which means nothing. So this is why most of the Palestine Red Crescent relief services were forced to stop during the past month because of the closure of Rafah crossing. And we renew our call for the international community to intervene immediately, to apply more pressure on Israel to allow the entry of a humanitarian aid. We need safe, sustained entry of a humanitarian aid to all areas of the Gaza Strip, including north of Gaza.
Now, given the recent massacre in Jabalia, how has the Palestinian Red Crescent been responding on the ground, and what are some of the immediate challenges your teams are facing in providing emergency assistance?
So basically, for the past month, the Palestine Red Crescent and other healthcare service providers have been prevented from reaching the areas in north of Gaza. So currently in north of Gaza, there is not even a single ambulance that is still operating in the area which are the besieged area. And here I mean Jabalia refugee camp, Beit Hanun, and Beit Lahia. However, our teams are able to work in the parts of the south of this governorate. So we managed to arrive the area of Jabalia, and our teams transported a number of the dead bodies and those who were injured to Al Ahli Baptist Hospital. The situation is horrific. We're talking about a big number, dozens of people were killed and injured during this attack at one of the homes, which is densely populated. And it was so hard to deal with this increasing number of victims, especially that there is no enough ambulances who are still operating in this area. And at the same time, we're talking about hospitals who are barely operational. So as hospitals who lack medications, medical supplies, having and to receive all this number of casualties at one time, it is absolutely hard for all of the doctors to continue providing their life-saving services for the affected population, especially within the extreme shortages of medications and medical supplies. The situation in north of Gaza is really hard because we're talking about not allowing civilians to receive emergency medical services through preventing the ambulances and rescue teams from reaching the besieged area in north of Gaza, and at the same time, repeated attacks at the hospitals and in the surrounding areas of these hospitals, not allowing medications and medical supplies even to be sent to these hospitals, has resulted to the very minimum medical services being provided by these hospitals, especially that most of the doctors were forced to evacuate, and these hospitals can't, like, barely literally provide first aid.
Yeah, speaking of hospitals, I want to shed light on this issue more because with Gaza's hospitals running out of medical supplies, like you've mentioned, what actions has the Palestinian Red Crescent taken to support the healthcare system, and what are the specific needs of the medical sector right now?
The Palestinian Red Crescent continue to provide its medical services and emergency medical services everywhere, including in north of Gaza, as much as we can. Today, as part of a coordinated mission, the Palestinian Red Crescent is working to evacuate a number of patients from Al-Auda Hospital to Al-Shifa Hospital in Gaza City. So this is one among several evacuation missions were made in coordination with our partners, including WHO and the ICRC, to evacuate patients from the hospitals in north of Gaza to hospitals in Gaza City. During the past month, and because of the continued military attack on north of Gaza, four of the Palestinian Red Crescent medical points were taken out of service. They are located in the claimed red zone area. We managed to establish a medical point in Gaza City so we can support the healthcare system, providing healthcare for the civilians, and we will continue to do so despite the shortages of medications and medical supplies, and at the same time, despite the risk that our teams endure. Since the beginning of the war in Gaza, we have already lost 19 PRCS members were killed while on duty trying to save other people's life. Dozens of our ambulances were taken out of service due to attack, and we will continue to provide our life-saving services for the community as much as we can.
That was the Palestinian Red Crescent spokesperson, Ms. Nabeel Farsakh. Thank you so much for your insights and for all the valuable information you provided us with.